I think there are three things that come to mind for me. Firstly, transformation partnerships like these really do require a longer runway. We've got to bear in mind the cohort that we're dealing with. They are complex, often multimorbid, and to deliver meaningful change, you need to be able to deliver that over time. Second, data has to be at the forefront of these partnerships. When you align on outcomes from the outset, you therefore can create a really interesting evidence framework for these partnerships to grow within. Data therefore becomes the engine for improvement and the lens through which success can be measured. And thirdly, if you bring those two elements together, so a longer runway for transformation to happen within, and secondly, a data-driven approach, you therefore create the right conditions for interesting commissioning arrangements. Let's take outcomes-based commissioning. You can start to align the partners on delivering better care over time and being able to take a gain share approach to how you share in the dividends of reducing the total healthcare spend for that cohort. The 10-year plan has created a really interesting blueprint for how commissioners can start to align incentives with outcomes. The integrated health organisation model is a really good example of that. So I see this as an opportunity for providers like acute trusts to start thinking about how do they support their most complex populations before they hit their front door. How do they align financial incentives with earlier and more cost-effective interventions? Because under those capitated contracts, they would take responsibility for the health outcomes of an entire population. Alongside that, the neighbourhood guidance is providing a place for really hyper-localised, personalised care that is community-facing. And thirdly, we have to think about workforce. How can we use digital not as a silver bullet, but as a really powerful enabler for our clinicians and staff? How do we predict early signs of deterioration and intervene much earlier? How do we automate transactional tasks? How do we task shift the administrative burden that often currently sits with clinical staff and enable them to focus much more on care delivery?